Dr. Khalid, thank you so much for joining us. How are you today?
Fine, thank you. Good morning.
Thank you for having the time for us today. I wondered if you could start by maybe clearing up some of the mystery around it and maybe providing an overview of Tourette syndrome, its symptoms, and how it can affect individuals who live with it.
So the Tourette syndrome actually is a common neurodegenerative disorder. Before it was considered rare, but now it's common, not rare. Usually it presents in childhood or in adolescence from 5 to 10 years of age. It has a multiple movement disorder, tics-like movement, and at least one of them is vocal phonic tics. The commonest tics are usually like blinking, coughing, sniffing, throat clearing. Typically, these are preceded by some feeling that the patient feels that the tics will come. And usually he tries his best to avoid it, but he cannot. Actually, it's associated sometimes with some condition called coprolalia, which is in minority of patients. There is an utterance of obscene words or socially inappropriate words or remarks. And this actually occurs in minority. Usually they are embarrassing to the family, to the child himself, but actually now by time is going on, usually these tics becomes less with time. This is the general description of the disease.
It sounds particularly cruel that a sufferer would feel the anxiety about the onset of a tic, which would then exacerbate the situation and increase the likelihood of it happening. What do you believe are some of the common misconceptions around Tourette syndrome that you frequently encounter, and how do you address them?
Usually, there is no specific. Actually, some of these diseases were undetected because usually they are mild sometimes, and sometimes they are going. The most important symptoms they are cleared, but the patient passed through his age from childhood to adolescent. But usually the best approach to the patient, usually it's a combination opinion with the family and with the treating physician and sometimes with a psychotherapist. There is no single effective medication, but usually it is a behavioral therapy is the first line of treatment, and the education of the family is very important, and for the school, if he is going to school. And this is an important part of any treatment plan. Sometimes it is coming with some stressful or psychological diseases like obsessive compulsive neurosis or attention deficit hyperactivity, ADHD, or anxiety or depression. Usually in these conditions, the patient should be referred to a specialized clinic because these conditions make the tics worse. So it should be treated by a specialized, actually, a clinic for psychiatric illnesses to be, to be in a better condition.
To look at that 360 approach.
Yeah. And the pharmacological treatment is usually reserved for more severe symptoms. Psychotherapy is also important, like cognitive behavioral therapy, and sometimes we advise the people to encourage their kids or children to do exercises. Usually, the exercise minimize the tics and the frequency and the severity of these tics.
Dr. Khalid with us this afternoon, shedding some light on Tourette syndrome. If you've got any questions, get in touch. Julie saying, having only watched Lewis Capaldi at Glaston recently, I was really struck by the outpouring of support and warmth. I think as a society we've come a long way. We've also had a couple of questions for you, Dr. Khalid. One anonymous saying, my sister has had physical tics all her life, turning her head. For example, she's 44 now. They flare up in stressful situations, but no other symptoms. Is it worth getting diagnosed? Would it actually help? I think that's an interesting point. If when we're thinking about what treatment or even labelling can look like. So to this brother or sister, 44-year-old sister who's got tics and has done since childhood, what would you advise there?
Yeah. Tics usually in this age we can't treat because if it is embarrassing in up to 44, if it does interfere with his social life, with her life quality, we have important treatment for this. Sometimes we can give medication, usually which we use for involuntary movement, And sometimes if it depends on the area where the tics, whether it's neck movement or facial twitching, because if it is in the face or small muscles, Botox sometimes we use to stop them, and it's successful in some conditions. So I cannot say, only if we see the patient and we see how can we approach, right, according to the location, to the severity, to the frequency. Some can be relieved by medication, sometimes by local injections, or sometimes by combination of this with the psychotherapy and some diseases for, medication for some depression or, anxiety.
So there could be some options there, if for a diagnosis in your 40s. A message here saying, can repetitive tics be part of another neurological disease? I think that's a really interesting point in terms of you can't treat one symptom in isolation. So what would you say to this listener asking about repetitive tics? Could it be something else, or does it tend to be Tourette's syndrome, Dr. Khalid?
No. I think this is the best. This is the most important choices that I gave you, and I think the isolation and depression is important, usually associated factor with these diseases, and usually this should be treated by a psychiatrist, by some anxiolytic medication or some antidepressant. They are very useful in these conditions.
Okay, Dr. Khalid with us today. We're having a deeper look at Tourette's syndrome.